Welcome to Next Gen Guides. If you're a student and need help in studying for exams, you are in the right place. So, you're gearing up for the IC&RC, Alcohol and Drug Counselor exam, and reading the material isn't enough. I will help you prepare with 15 practice questions that have been designed to mimic the style and cover key domains you may encounter on the ADC exam. We'll go through each question. I'll give you a moment to think, then we'll break down the correct answer and explain why it is the correct answer. Now, grab a notebook, get comfortable, and let's dive into these questions. Question 1. In cognitive behavioral therapy, CBT, the focus is primarily on. Options are A. Exploring unconscious conflicts. B. Identifying and changing maladaptive thoughts and behaviors. C. Analyzing family dynamics. Or D. Promoting self-actualization. The correct answer here is B. Identifying and changing maladaptive thoughts and behaviors. CBT is all about how our thoughts, feelings, and behaviors are interconnected, and by identifying unhelpful patterns, clients can learn new, more adaptive ways of thinking and acting. Question 2. A counselor uses reflection as a core skill in motivational interviewing. Which of the following is an example of a complex reflection? A. So, you're feeling angry. B. You're saying you're tired of feeling this way, and part of you wants to change, but another part is scared of what that change might bring. C. Are you ready to quit? Or D. Tell me more. The correct answer is B. You're saying you're tired of feeling this way, and part of you wants to change, but another part is scared of what that change might bring. A simple reflection just restates what the client said, like option A. A complex reflection adds meaning or interpretation, often reflecting both sides of a client's ambivalence, as seen in option B. Question 3. What is the primary goal of motivational interviewing, MI? A. To persuade clients to change their behavior. B. To elicit and strengthen the client's own motivation for change. C. To provide direct advice and solutions. Or D. To confront client denial. The correct answer is B. To elicit and strengthen the client's own motivation for change. MI is client-centered and non-confrontational. Its core purpose is to help clients explore and resolve their ambivalence about change, drawing out their internal reasons for wanting to change. Question 4. A client expresses feelings of hopelessness and worthlessness. Which counseling approach would focus on helping the client identify and challenge these negative self-statements? A. Psychodynamic therapy. B. Humanistic therapy. C. Cognitive behavioral therapy, CBT, or D. Family systems therapy. If you picked C. Cognitive behavioral therapy, CBT, you are correct. As we discussed earlier, CBT directly targets maladaptive thoughts and helps clients challenge and reframe negative self-statements that contribute to feelings like hopelessness and worthlessness. Question 5. Empathy, in counseling, is best described as A. Feeling sorry for the client. B. Understanding and sharing the feelings of another. C. Giving advice based on personal experience. Or D. Remaining emotionally detached from the client. The correct answer is B. Understanding and sharing the feelings of another. Empathy is about stepping into the client's shoes, truly understanding their perspective and feelings, and communicating that understanding back to them without necessarily experiencing the same emotion or offering advice. Question 6. Which group counseling model emphasizes mutual support, shared experiences, and peer accountability? A. Psychoeducational groups. B. Process-oriented groups. C. Support groups, e.g., AW, or D. Skills-building groups. The correct choice is C. Support groups, e.g., AW. These groups are built on the premise that individuals with shared struggles can provide powerful support, accountability, and a sense of community to one another, often utilizing a peer-led model. Question 7. A client reports experiencing intense cravings for their substance of choice. Which counseling intervention would be most appropriate to help them manage cravings? A. Encouraging them to give in to the craving. B. Discussing the historical roots of their cravings. C. Teaching coping strategies like distraction, delay, and alternative activities. Or D. Telling them to simply stop thinking about it. The best answer here is C. Teaching coping strategies like distraction, delay, and alternative activities. Effective craving management involves providing clients with practical tools and techniques they can use in the moment to reduce the intensity of cravings and prevent relapse. Question 8. What is the purpose of psychoeducation in substance use disorder counseling? A. To diagnose psychiatric disorders. B. To provide clients and families with information about addiction, recovery, and coping skills. C. To analyze unconscious motivations. Or D. To conduct group therapy sessions. The correct answer is B. To provide clients and families with information about addiction, recovery, and coping skills. Psychoeducation empowers clients by giving them knowledge about their condition, the recovery process, and practical skills they can apply to their lives. Question 9. A counselor helps a client identify their triggers for substance use. What is a trigger? A. A positive reinforcement for abstinence. B. A situation, person, place, or feeling that increases the likelihood of substance use. C. A healthy coping mechanism. Or D. A goal in the treatment plan. The correct answer is B. A situation, person, place, or feeling that increases the likelihood of substance use. Triggers are cues that can prompt cravings or lead to a relapse. Identifying them is the first step in developing strategies to manage them. Question 10. Which counseling skill involves restating the client's message in your own words to ensure understanding? Options are A. Paraphrasing. B. Summarizing. C. Reflection of feeling, or D. Confrontation. The skill described is A. Paraphrasing. Paraphrasing is a way to show the client you're listening and to confirm that you've accurately understood their verbal message. Summarizing covers a longer period or multiple points, and reflection of feeling specifically targets emotions. Question 11. A client consistently misses appointments and makes excuses. In a non-confrontational manner, the counselor points out this pattern and its potential impact on treatment. This is an example of A. Giving advice. B. Confrontation, gentle challenge. C. Sympathy. Or D. Affirmation. This is an example of B. Confrontation, gentle challenge. While confrontation can sound harsh in counseling, it often means gently pointing out discrepancies, patterns, or inconsistencies in a client's words or behavior to help them gain insight, rather than accusing them. Question 12. What is the primary benefit of involving family members in a client's treatment, when appropriate and with consent? A. To assign blame for the client's addiction. B. To provide additional financial support. C. To improve communication, reduce enabling behaviors, and create a supportive home environment. Or D. To ensure the client does not relapse. The correct answer is C. To improve communication, reduce enabling behaviors, and create a supportive home environment. Family involvement, when done therapeutically, can significantly enhance a client's chances of sustained recovery by addressing family dynamics that might contribute to the problem and building a strong support system. Question 13. A client is struggling with low self-esteem. Which counseling technique would focus on acknowledging their strengths and efforts? A. Confrontation. B. Affirmation. C. Interrogation. Or D. Interpretation. The answer is B. Affirmation. Affirmations are statements that recognize and acknowledge a client's strengths, positive qualities, efforts, and achievements, which can be incredibly empowering, especially for those with low self-esteem. Question 14. What is the primary focus of relapse prevention planning? A. To prevent the client from ever using substances again. B. To identify high-risk situations and develop coping strategies to avoid or manage them. C. To punish clients for past relapses. Or D. To encourage clients to avoid all social interaction. The correct answer is B. To identify high-risk situations and develop coping strategies to avoid or manage them. Relapse prevention isn't about guaranteeing no future use, but rather equipping clients with the awareness and skills to navigate challenging situations and minimize the likelihood of relapse. And finally, question 15. During a counseling session, a client becomes agitated and raises their voice. What is the most appropriate initial response from the counselor? Options are A. Match their tone and raise your voice back. B. Immediately terminate the session. C. Remain calm, acknowledge their feelings, and attempt to de-escalate the situation. Or D. Ignore the behavior and continue with the agenda. The correct and most therapeutic response is C. Remain calm, acknowledge their feelings, and attempt to de-escalate the situation. Maintaining composure helps de-escalate tension. Acknowledging their feelings validates the client, and then you can collaboratively work towards a calmer state. How did you do on this practice test? Let us know in the comments below. If you found this helpful, please like this video, subscribe to Next General Guides for more AI-powered study materials, and hit the notification bell so you don't miss our next video. Keep studying smart, and we'll see you next time.